I'm the CEO for Hamilton Community Health Network, and I'm pleased to welcome all of you to our main clinic here in Flint. Today we have the pleasure of welcoming Senator Debbie Stabenow to Hamilton, and it is always exciting to host a press conference to publicize a new program. But it is special when your senator wants to be present and make a personal appearance. This program will help our seniors as well as thousands of seniors throughout our nation. So thank you very much, Senator, for all that you do, and we appreciate everything. Yes. Every day here at Hamilton, our providers, nurses, and support staff provide high quality, affordable, accessible health care to our patients, yet many struggle to pay for their prescription medications. Many of our seniors who are on Medicare are prescribed life-saving medication such as insulin and, of course, blood pressure medication. Yet many can't afford their prescriptions. In fact, according to the Centers for Medicare and Medicaid Services, 1 in 3 Medicare beneficiaries have diabetes, and more than 3.3 million Medicare beneficiaries use insulin. Here at Hamilton, many of our seniors are being treated for diabetes, but find it difficult to afford the medication. In some cases, they are forced to choose between purchasing their medication or buying groceries. That is why this program is so important to our seniors. Capping the cost of insulin at $35 per month for our Medicare patients can be life-saving. Capping these costs for our patients will give them the ability to afford their medication without sacrificing groceries, and in return, they will live a healthier life. Again, I want to thank Senator Stabenow for taking the time out of her busy schedule to celebrate this great achievement for our seniors, the passage of the Inflation Reduction Act of 2022. Thank you, Senator Stabenow.
Well, thank you, Clarence. It is always great to be here at Hamilton. It's so wonderful to be back with all of you. And first of all, thank all of you who do such wonderful work here at the Hamilton Community Health Network. And I remember being here a number of years ago as we were doing a press conference to champion my work, it really bipartisan work to support community health centers that we've been able to do over and over again. I'm putting in a bill again this fall to continue the funding for community health centers to support what you do. And right now, we are in National Health Center Week. And so across the country, we are celebrating the wonderful work that everyone does in the community to support all of our residents, whether it's a senior, whether it's a child, whether it's a family. Thank you so much for what you do. And I'm so glad that Yoshika is here as president and CEO of the Valley Area Agency on Aging. So thank you, Yoshika, for being part of this and for all of your leadership with the Area Agency on Aging. This is an important achievement that we are about to fully make happen and get to the President of the United States. We passed in the Senate last week. This Friday, we are going to see this pass in the House of Representatives and be sent to the President. Finally, a bill that's going to lower prescription drug costs. We have been saying for years, I've been saying for years, that Medicare should be able to negotiate. Medicare is the largest payer for prescription drugs, but it's been actually barred by law. The drug companies were able to get language when Medicare Part D was passed in 2004, I believe it was. They were able to get language in there stopping Medicare from negotiating the lowest price. Now the VA negotiates for veterans, and veterans pay about 40% less. But Medicare has been barred for doing that. Well, not anymore, because we're going to make sure that Medicare is moving forward to negotiate the very best price for our seniors and people with disabilities. And Medicare drives pricing in the private sector as well, just in terms of competition. So I think this is going to have a broad impact. And I remember back when I was in the U.S. House of Representatives back a while ago, 1998, I was 5 years old, and we were putting together a busload of seniors. We called it the Stabenow RX Express. I still got the banner. And we had a group of seniors, parents, in the bus, and we went from Detroit, 10 minutes across on a bridge to Windsor, and dropped prices 40% by crossing the bridge. And prices have just gone up and up and up and up since then. The reality is, we as Americans pay the highest prices in the world, on average 3 times more than people in any other country, and yet the drug companies have the highest profits in the world. And on top of that, while they talk about the need to put money into research, the vast majority of basic research is funded by American taxpayers through the National Institute of Health. Hundreds of billions of dollars. I support doing that. But I think if we're going to have a stake in it and support the development of these new medications, then we shouldn't pay the highest prices in the world, bottom line. So Medicare is going to begin negotiating the best price. And then, on top of that, as Clarence was saying, for the 1 out of 3 Medicare recipients that are on insulin for diabetes, we're going to, starting in January, cap the out-of-pocket cost at $35 a month. Not hundreds of dollars a month, $35 a month. We have over 2 million Michigan residents who rely on Medicare, and 1 out of 3 of them are using insulin. They're diabetic. The other thing that we're going to do is we're going to cap the out-of-pocket costs, the yearly costs for anyone on Medicare, to a total of $2,000, and you'll be able to spread that out on a monthly basis. Now it's thousands and thousands and tens of thousands of dollars a year for someone on Medicare. But we're going to cap that again at $2,000. We also are going to penalize any drug company that is raising prices faster than the rate of inflation. That is not happening now. And in fact, while we are in the middle of pushing on prescription drug prices, there have been only over 1,200 price increases this year, 100 last month. While we were in the middle of writing this bill and pushing it through, and the drug companies have been fighting us like crazy, putting up all kinds of misinformation on TV about this, they were raising 100 different drugs in price just last month. So we said, this is it. We've had enough on this. We also are going to be continuing really important tax credits that lower the costs of health care for anyone in the Affordable Care Act or in Michigan using the Affordable Care Act exchanges. We reduced costs last year. Those were about ready to expire and go back up. And so we're continuing that as well. From my perspective, this is long, long overdue. Just one story, sort of what has happened over the years. Insulin was actually developed over 100 years ago. So when the drug companies say, well, we have to have prices high to recoup our costs, over 100 years ago, insulin was developed and has not substantially changed in 100 years. Interestingly, it was developed by 2 Canadian doctors who felt it would be unethical to make money off of something so important as this life-saving drug. So they gave the patent to the University of Toronto for $1. Now, insulin has tripled in cost in the last 10 years. Up and up and up and up. No excuse for it. It's just about price gouging, big drug company profits, and we are now saying this is enough. This is enough. Colleagues on the other side of the aisle can stand with the drug companies and their profits. I'm standing with people, my colleagues, Democratic colleagues, standing with people to say you deserve to have access to your medicine and not have to decide whether you're going to pay your rent or get your food. So that's what we're doing. So I want to turn this on. I'm such a fan and supporter of the area agencies on aging. And Yushika, Albert, thank you so much for your leadership.
Thank you.
Thank you. Please.
Well, I want to say thank you to Mr. Pierce, who's always been an advocate for seniors, but thank you, Senator Stabenow, for being a champion for seniors in Michigan. They spoke already about seniors choosing between life-saving medications and paying utilities and food. But we know of seniors who actually ration their medicines to try to get them to stretch, to last longer, which is devastating and could have lifelong health effects, could even prove to be deadly. So what we want to happen in being able to afford prescriptions and the initiatives that Senator Stabenow has taken forth, including the caps and renegotiating medication prices and all of the initiatives that she's put forward, we are so grateful, so very grateful that our seniors that are on fixed incomes, many are on fixed incomes. They don't have to make those life decision choices. And what we want to say at Valley Area Agency on Aging is if you have any questions about your Medicare, your Medicaid, any questions like that, or if you want to review your medications, which you should be doing annually against your Medicare supplement plan, that open enrollment starts in October, mid-October. It goes through mid-December, I believe. And you can give us a call at 810-239-7671. Again, that's 810-239-7671. And ask for the Medicare, Medicaid prescription program. It's called MAP. And we can help walk you through we're neutral. We don't own any plans. We walk you through all of your medications and see what plan best meets your needs in terms of cost and medication coverage. Everyone should do that annually. But again, thank you so much for being an advocate for seniors when many of our seniors are on 5+ medicines. Thank you.
Thank you so much. Thank you so much. And at this point, we will close the press conference. I'm happy to take any questions, either here from the mic or if you want to do it individually, however you would like to do that. But again, I also want to say happy National Health Center Week because we are at a wonderful place that we are blessed to have in Flint. And this center saves lives. And so thank you.
Thank you.
Thank you, thank you, thank you. So, should we do this individually? Okay, great. Thank you so much. We'll chat with folks individually here. So thank you. So, oh, sure. Let's definitely get a photo. Let's get a photo here. How about this?